Let's take you to Birchwood. That's where President Cyril Ramaphosa is delivering the keynote address as DENOSA marks the opening of their 9th National Congress. Let's listen in.
National office bearers of DENOSA, the leadership of COSATU, who are here present, as well as the leaders of various other trade union organizations and representatives of the Alliance. And I do believe that there are also representatives of the South African Nursing Council, representatives of the International Council of Nurses, and other international fraternal organizations. The academia and research fraternity is also here, government officials who are also here present, and ladies and gentlemen. It's a real joy and a pleasure to be here, particularly as I came in, I heard the rules of this Congress very clearly. I heard a pronouncement of a 3-minute limit to speakers, so I will speak for 3 minutes. But I also heard that there should be no songs that promote any individual. President of DENOSA have already identified people who are leading those songs, and I've heard that they may be expelled from the conference. Allow me to really thank you for inviting me to come and speak to you at your 9th National Congress. This is the first time I've had the occasion to address DENOSA since the outbreak of COVID-19. It was just 5 years ago that we faced the worst global health crisis and emergency in modern times. The pandemic in many ways changed our world almost overnight, and we became used to lockdowns, which many people hated me for as I had to announce them. We became used to wearing masks and social distancing. Many lives were lost to the virus, and the virus shattered many lives and many families and communities. During that pandemic, we lost many nurses and healthcare officials, workers, brave men and women who were at the forefront of the pandemic were lost to us. And brave is not the adequate word or the appropriate word to describe them. Many of you faced the danger of being infected. Many of you faced the danger of death, but you still went on to care for those who were affected. And despite the risks to your own health care, you continued to provide treatment, you continued to provide care and support to our people. And much as it is almost 5 years later, I think it is important that we should continue to remember those who died during this pandemic, particularly your colleagues who died in the course of duty, who died as soldiers fighting to save the lives of many. I'd like us to take this opportunity to rise and remember them and observe a moment of silence. Thank you. You may be seated. We do and must salute all those who lost their lives. They embodied the finest values of the nursing profession, including a clear demonstration of passion, professionalism, and courage. It is in great measure thanks to their efforts that our country, and your efforts as well, that our country was able to recover from COVID-19 and to begin the task of rebuilding. So we are eternally grateful to your work, to your fortitude, and to your courage. People may see you wearing your white uniform, they see you walking around in wards in hospitals, but they may not know that you are the real soldiers that are saving our country and its people on a daily basis. Thank you very much for what you do. Your calling requires strength of character and commitment to service that is rare. Even under difficult conditions, it is your responsibility to administer quality care, to reassure those who are sick, and to deal with anxious families. For when we are sick, our families become very anxious, and you are at the front line to give the care and the assurance to our families, and you are the first counselors that our families encounter. We should recognize the efforts to elevate the stature of the nursing profession in democratic South Africa. During apartheid, nursing was one of the few occupations open to black professionals along teaching and the police service and a handful of other professions. The training and opportunities available to black nurses mirrored the inequalities of the skewed education system. The training and development of white nurses took priority in our country. Black nurses were expected to only care for black patients in black-only hospitals. The hospitals and clinics assigned to serve the country's majority were under-resourced and chronically underfunded. And it is for this reason that Minister Motsoaledi is such in great spirits in having heard me saying that we must focus on healthcare. And I want to reiterate on the health sector, I want to reiterate what we said during SONA, that we will help and we will ensure that we resource the health sector, and we will make sure that we build hospitals, we build clinics, and we strengthen the healthcare system in our country. This is a commitment that we will achieve, and this is what we are going to do. At that time, black nurses had unfavorable working conditions, were paid far less than their white counterparts, and had fewer opportunities for advancement. That was the reality of those who were in the nursing profession at the time, pre-democracy. It was under these conditions that black nurses organized and fought for their rights, engaging in civil action and strikes dating back to the late 40s. Since 1994, we have taken active steps to ensure that the nursing profession takes pride of place in our health system. In 2005, we passed the Nursing Act to enable the professionalization of nursing and to facilitate the establishment of the South African Nursing Council. Successive regulations have also been passed that deal with the scope of practice for nurses as well as for midwives. DENOSA, your union, is to be congratulated for nearly 3 decades of dedication and service to the people of South Africa. I repeat, your union, called DENOSA, is to be congratulated and commended for nearly 3 decades of dedication to the service of our people. Yes, I thought you hadn't heard, that's what. And I thought that some of you may even have forgotten that your union is called DENOSA. We all appreciate the difficult balance that must be struck between advocacy and activism, on the one hand, and fulfilling the rights of patients to treatment and care on the other hand. Now, this balance can be achieved in an environment where the rights of both nurse and patient are respected. At this crucial moment in the history of democratic South Africa, we do call on DENOSA to continue to assert its vanguard role when it comes to health matters. We have a government of national unity which has 3 strategic priorities for the next 5 years. Firstly, driving inclusive growth and job creation. Secondly, reducing poverty and tackling the high cost of living. And thirdly, building a capable, ethical, and developmental state. The nursing profession is integral to the advancement of all these strategic priorities. In particular, nurses have an important role to play in building a capable state. Nurses are part of the hard-working, dedicated core of public servants that keep this country going from day to day. It is encouraging to see more new nursing registrations with the South African Nursing Council. At the same time, however, we are seeing a decline in training numbers. This decline cannot be simply explained by less people seeing nursing as an attractive career, but that factors such as accreditation delays also play a part in all this. And I don't know why the accreditation process is taking so long when so many do want to be part of your profession. Now, I welcome the fact that this is one of the issues you are going to discuss at this Congress. And I'm hoping that you'll be able to come out with an answer or a solution. In an environment where South Africa has a shortage of nurses, we are encouraged that the issue of South African nurses being recruited in large numbers by other countries is also on the agenda. You need to discuss how we deal with the specter of recruitment that is taking place amongst those of your profession to other countries. Is it money that... Now, there was a time when others were saying, no, let us allow them to go and earn at foreign currency. But at the same time, we are depleting the numbers of nurses in our own country. And of course, those in other countries want to recruit you because you are so good. You are so well trained. You are some of the best that there is in the world. Now, achieving improved equitable health outcomes across the population is a critical enabler of economic growth and poverty reduction. DENOSA is called upon to ensure that the training and capacity building efforts that are currently underway in support of its members and more prevalent. DENOSA needs to be more engaged in policy development, which you are, and you must ensure that as new policies emerge, the nursing profession has made inputs and considered the impact of those new policies on their members. The support of DENOSA will be pivotal as we prepare for the National Health Insurance. The passage of the NHI Act was in many ways a milestone in our ongoing quest for a more just society where one's ability to access quality health care and services is not determined by where one comes from or from one's ability to pay. The NHI will bring us closer to our aspiration of being a society where human dignity of all is upheld at all times. The right to dignity matters most when people are sick, when they need help, and that is the time when they are most vulnerable. Our nurses will be the backbone of the national insurance, health insurance. You are going to be the real backbone. When people look at how we're implementing the NHI, the first point of call will be the capability, the ability of our nurses to be able to improve the delivery of healthcare in our country. So you are going to be at the center of it all. And it is you who people are going to look at. We urge DENOSA to be at the forefront of the discussions around skilling and training, around strengthening the healthcare system, and other crucial matters. I'm delighted that at this conference, this Congress of yours, you are going to have time to discuss all matters that are related to healthcare. And our nation needs to pay attention to some of the policies, some of the decisions that you are going to come out with. It is through those decisions, those resolutions, that you will be able to strengthen your resolve and your dedication to deliver quality health care to our people. Beyond preparing for the NHI, the nursing profession faces emerging challenges. Many of these are on the Congress agenda, such as litigation against nurses, where people are suing a number of you for a number of challenges or matters, and the growing trend of undocumented patients from neighboring countries seeking treatment in South African public health facilities. These are all important issues that DENOSA will need to deliberate upon as it charts a new course for the South African nursing profession. And as you do this, you must remember that you are the pivotal players in our healthcare system. This vital profession is key to South Africa's progress and development. Nurses are the foundation of an efficient healthcare system. And without the dedication and the expertise of your members, medical services would be inadequate, leading to poor health outcomes. It is therefore important that we should invest in ensuring that there is good nursing education, fair wages, the issue that you particularly like, and better working conditions for our nurses, as this will lead to quality health care in our country. And I do agree that your conditions of employment and your salaries, your remuneration, is linked with the quality of health care that you can deliver. So we cannot separate both of them. Now, I stand here also to say, whilst in past years, what we have seen as our fiscal space has been narrowing and becoming more and more challenged, in this year's budget, we've ensured that the scaling down of financial resources available to the health sector is held back, and in fact, we see an increase in allocating more funds to health so that we can employ more nurses. We can also employ unemployed doctors. So that we will be able to do. Now, this demonstrates government's commitment to ensuring that there is better health for our people. And at times we don't really realize it, because at times as we stand and speak we are not sick. But it is when people are not well and they need health care that we begin to realize the importance of the allocation of resources to ensure that we do have quality health care. Now, as government, we remain firmly committed to working with you as DENOSA and with Labour in general. And it's good that we have the President of COSATU here, and working with all other stakeholders to overcome challenges and to enable nurses to work in the best conditions possible. As the nursing profession ably demonstrated during COVID-19, nursing excellence can confront and overcome the greatest of difficulties. Working together, and during COVID, many would have spoken about, yes, we deployed soldiers to enforce and to ensure that the lockdown provisions are observed, and the police and all that. But it was yourselves who were more at the front line than any other worker that you can think of. Now, you face the real danger because you were interfacing on a minute-by-minute basis, on an hourly basis, with those who were infected by the COVID-19 virus. Working together, I do believe that we can overcome the challenges in our health system, and it requires our full dedication and our full commitment. Working together, we will be able to define as well as to chart and implement a new course for South African nursing into the future. And I'd like to thank you all once again for being the frontline soldiers of our people's health. We are the frontline soldiers. Yes, admittedly, you don't carry guns. Admittedly, you don't carry bombs. You are the ones who take your heart, your full dedication to serving the people of South Africa. And I do thank you for that. We're eternally grateful. And once again, President of DENOSA, I'd like to thank you for asking me to come. I do believe that I did stick to my 3 minutes. And I'd like to thank you and wish you all the very, very best Congress. It's been whispered to me that I was told that, President, don't worry, we're not going to fight at this conference. So Those who may have wanted to come to fight, they say they will be disappointed. This is going to be a good conference, and I can feel it and I hear it. Thank you very much.